I initially started my training up in Scotland, and then I transferred down to northeast of England, and I find training in both places excellent. It's very comprehensive. It's of very high quality. You do have consultants that are sort of well recognized, either national or international level even, and to be able to work with them, train under them, that certainly has helped shape who I am today. Life as an ophthalmologist is quite exciting. So we usually have two clinical sessions in a day, so morning and afternoon. So it could be a clinic in the morning or in theatre in the afternoon. What would be the most satisfying and most fulfilling for my job role would be to help patients regaining sight. As an ophthalmologist, we obviously focus a lot on patients' eyes, and restoring sight or at least maintaining sight for patients would be our main goal, really. I have to say that my experience with the teams have been all excellent. The team members I work with, whether they are your peers or consultants, have all been very supportive of each other. Anytime when you have questions or any sort of clinical queries, consultants have been sort of very willing to undertake the responsibility, helping. That itself has definitely affected my sort of choice of wanting to stay in the Northeast region to being a consultant. Northeast Deanery perhaps is a very research active deanery, especially in Sunderland Eye Infirmary. We are one of the centres that's highly regarded in running several clinical trials nationally, and it is even more exciting that the Sunderland has sort of announced a new sort of establishment of a Northern Research Institute that would be coming sometime mid-2026. So I think that as well would promote more research activities within the region. And as a trainee, as a registrar, certainly you have a lot of opportunities to get involved if you're interested. We have a very exciting development coming into place in summer 2026. The new eye hospital within Sunderland is being built. We're excited to be moving into a place with great infrastructure for us to be able to continue delivering eye care to our patients and sort of continuing the tradition of the Sunderland long-standing history of being able to provide eye care for patients. To get into training is a very competitive process. So my top tip would be, if you are really interested in ophthalmology, you can try to get in touch with the department, your local department, to ask if you could try to shadow them, try to see what it's like, and sometimes you might have a little bit more insight talking to people who are on the job, and also trying to get involved in any other projects that you might be able to get into. I know if you are a medical student, you might think that you might not have a lot to contribute, but actually we do value medical students' contribution. That would help in terms of your portfolio for interview as well. You can always apply for a taster week when you're doing a foundation year, and that itself again would help to boost your points in portfolio when it comes to ophthalmology. I've been very privileged to be able to live and work in the Northeast. I find the people that I come across, they're very friendly, be it your colleagues or your patients. They have very nice manners, very sort of friendly to each other. The other thing that I found that's very valuable in the Northeast, you have the coast within reach, then you have national trust. Northeast compared to the South is much more affordable, so to get into a property ladder, it would be much easier in Northeast compared to the South. So I think again that would be a plus point to be living in the Northeast.